skyrocketing to new records. And now
the surge in COVID cases in Oregon, Washington, and across the country has people on edge. Testing is more important now than ever. So when an Oregon company in viral tech emailed offering to send an at-home COVID surface test, I said yes. Businesses use the kit to test high-traffic areas to try and detect COVID before an outbreak. The email from EnviralTech also spurred me to start researching other at-home COVID tests, from the companies, the cost, and effectiveness. These tests are for people, not businesses, and there are a lot of them. The FDA just authorized the first at-home rapid COVID test. You administer the test on yourself at home and get results on the spot in 30 minutes. But that won't be available nationwide until the spring. So what's available right now? Currently, there are 9 companies allowed to sell at-home testing kits by the FDA. They cost between $109 and $155. They use a nasal swab or saliva collection method. You have to fill out a short questionnaire before getting the test delivered to your home, and you have to send the test back to a lab for results. I asked KGW medical expert Dr. Payal Kohli for her take.
What are your thoughts on these, at-home COVID tests?
There's absolutely no doubt in my mind that testing needs to be more widespread and more accessible. And that's the huge advantage of these at-home tests, is that they really do bring testing to the person's bedside. But the flip side of the coin is that the tests have to be accurate. And in my opinion, having a bad test is actually worse than not having a test at all.
While the labs claim high accuracy, Dr. Kohli points out all of the tests were given emergency FDA authorization, which is different than full FDA approval, meaning the tests did not go through the same rigorous review. She said the collection process could also be an issue.
So specifically for the self-collection kits, you have to put that swab in there, and there are rules given by the CDC as to how long it has to sit in there, how much you have to swirl it around, how far in you have to get it. So all of that is highly dependent on the person who's collecting the sample, and it could very easily have a false negative if somebody doesn't collect their sample appropriately.
We ordered 2 of the at-home tests to see how the process worked. Both use nasal swabs, and both had how-to videos on their website you could watch before taking the test. I ordered the Pixel test on a Thursday. It came mid-morning Friday and cost $119. The instructions were easy. I did my best with the swab and sealed everything up to be sent. The Everlywell test cost $109. I ordered on a Thursday, and it came Friday around 6 in the evening. Both companies said you should take the test and send it out on the same day, and you should not put the kits in a FedEx or UPS box over the weekend. I waited and took both tests on Monday. The Everlywell instructions were a little more involved. For this test, they said to tilt your head back for the nasal swab. You also had to break off the handle of the swab before putting it in the tube and sealing it up. I sent both kits off to be tested in a lab.
I watched a video, but I've never done this before. Does that concern you that, all of these people are ordering tests and then having to do them on themselves?
It does concern me. And I think if we are going to shift from testing from, public health societies and hospitals to at home, which plausibly we could do, then we do need a public health campaign to educate people as to what the correct way to do it is. Just like we did with educating people about how to wear masks and educating people about how to wash their hands.
I got my Pixel results late Tuesday. I tested negative for COVID. The Everlywell results didn't arrive until Thursday. I was also negative. But with the cost and time it takes to get the test and wait for results, I wondered who the tests were meant for. Health experts say there are 2 patient populations the at-home test may work for: patients in rural areas without access to testing sites, or high-risk patients who want to be tested without leaving their homes.
I can really see this testing kit playing a niche role in that type of patient population.
As for the EnviralTech surface test, the Oregon company who emailed me and kicked off this whole story, I received 8 swabs and 8 tubes. We tested keypads, doorknobs, and other surfaces all over the station and sent that off the same day. Companies like nursing homes use the swabs to see if COVID is on a surface before an outbreak is detected. We received the results late the next day, every place we swabbed tested negative for COVID.
None of the surfaces that you've collected samples from showed any signs of COVID. So that's a good thing.
Exactly. So that's what you want, correct?
Of course. I mean, of course, you were looking to not have COVID present in your facilities, although we work with a lot of long-term care and senior care facilities. So a positive test, we don't want to see it, but it's helpful because it tells them that they need to take more precautions. Maybe they need to identify who it is who's shedding virus and remove them from the facility, do more cleaning and disinfecting, and that sort of thing.
The bottom line with all these at-home COVID tests, just because you test negative doesn't mean you don't have COVID.
We saw this with President Trump, who is being tested daily. So the negative test today just means there's not enough virus to trigger positivity. It does not mean that there's no virus at all and that you're safe.
Meaning if you get COVID and get tested on the same day, you'll most likely test negative. People should not be using these tests as a way to justify having a large gathering, not wearing masks, or not social distancing.